welcome to another one here. So we're starting with the subcortex. We're going to be beginning with a general arrangement of what the diencephalon is. So this is the diencephalon. So familiarise yourself with this mid-sagittal section. This is your bread and butter. These come up all the time in prosections. It's fantastic for imaging. Lots of nice, big, nitty-gritty structures. The diencephalon is the whole green region. We're dividing it into 5 things. You should already be well familiar with the things in yellow. The thalamus, the subthalamus, and the hypothalamus. You should have heard of all of those before. You might not have heard of the epithalamus and the metathalamus here. And that's fine. The epithalamus is a structural set of things. We have the stria terminalis, which connects the amygdala to more anterior structures. And we have the habenula trigone, which we'll come to, but it sits at the back and sort of connects the pineal gland to more anterior structures as well. The metathalamus are the geniculate bodies on the posterior of the midbrain. So you have your superior and inferior geniculates, the geniculates. So you have those geniculates which are well accompanied with, which are the medial geniculate nucleus and the lateral geniculate nucleus that connects to the superior and inferior colliculi. Okay, so your medial geniculate nucleus and your lateral geniculate nucleus, and these regions just off the thalamus are termed the metathalamus. They're not actually the thalamus, they are accessory nuclei that are attached to the thalamus, but are not the thalamus. So, here's a few of those structures that we just mentioned. So the epithalamus going forward, you can just recall what those were, 2 different structures. And this is a really good, to the right here, we have a really good example in situ of all of these different structures we've been talking about, okay? So your basal ganglia out here laterally, your thalamus medially. See how the caudate arches over here, and then it has this strip-like connection, so between the caudate and the putamen out here. Hence, the caudate and the putamen together are called the striatum. You can see the cingulate gyrus overhanging all of those things, which means that the corpus callosum will be deep to this, or sorry, will be just beneath this here. Here's the hypothalamus, below the thalamus with the infundibulum and the pituitary gland hanging off there. You have the hippocampus here and the amygdala there, and therefore you know that this must be the parahippocampal gyrus. And here's a few more structures, so pause the video and see how many of these you can figure out. So we have the fornix here. This region is called the column of the fornix. This is this region here is the interventricular foramina of Monro, which connects the 2 ventricles and sort of, studs the midline, if you will. You have the telechoroidea of the 3rd ventricle here, which is sort of like a choroid plexus-like structure. You have the pineal gland overhanging here with the habenula coming off either side, the bilateral habenula, hanging that pineal gland, the secretor of melatonin, crucial regulator of your sleep-wake cycle. This is the hypothalamic sulcus, so everything superior to this is thalamus and everything below it is hypothalamus. We've got the posterior commissure, we have the anterior commissure over here, but that's cheating. And these are just commissural fibres, and if you remember from your definitions, those connect similar structures across the hemispheres, as opposed to your projections, which is from the hemisphere down, or your associations, which are white matter tracts that connect things of the same hemisphere. So you need to know the 3 different types of those white matter tracts. We have the cerebral aqueduct of Sylvius here, connecting this ventricle here to the 4th ventricle. Then we have the mammillary bodies at the back. This is the posterior section of hypothalamic nuclei. We have the infundibulum, the stalk connecting the hypophysis, or the pituitary gland, to the hypothalamus. We have the optic chiasm over here, and a very important structure. Look, here's the optic chiasm, here's the pituitary. So hypertrophy of this structure could very quickly cause that bitemporal hemianopia, which is so well described for pituitary adenomas. We have the lamina terminalis, which we might not have come across yet, and that anterior commissure. So again, always relate this to prosections. So the septum pellucidum is removed here, so you can see more of a sort of lateralized version of those structures. You can see where the ventricle will be embedded. Here's your intothalamic adhesion. You've got your fornix, septum pellucidum would be here, the different regions of the corpus callosum, your cingulate gyrus. Be starting to think about structures that you can see and the different fissures that you can see. So, recap, what is the hypothalamus? It's the stria terminalis and the habenulum. So your stria terminalis connecting the amygdala, it's this green bundle here running forward. You can't really see it grossly, but it's to be appreciated histologically and functionally. Connecting this amygdala up to this hypothalamic region and all of those hypothalamic nuclei, in the same way that the fornix and the fimbri are doing the same thing for the hippocampus. So you could crudely think of this stria terminalis as a similar functional thing. And the hypothalamus, of course, is going to be acting out all of the autonomic functions related to the hippocampal and amygdala's processing. So that's our stria terminalis. And here's another view where you can see a few of those structures. In particular, the habenular nucleus, and there'll be habenular commissures connecting the pineal gland there. So, location of the third ventricle and its relations. So, again, take a moment. This is a beautiful picture here. We can see quite a few structures. So the third ventricle is in the midline. Either side is the thalamus. Above it here, we have the hippocampus, don't we? The hippocampus here. And then what does the hippocampus become along here as it's coming out? The fornix. Yeah, we've got the septum pellucidum. We've got ventricles here. We've got corpus callosum up here. We have the massive head of the caudate nucleus, and then it's been sort of dissected away there. We have the corpora quadrigemina, your superior and inferior colliculi here. We have the pineal gland, and then we have the habenular trigone, which are these structures here, running anteriorly to supply. And in green are nestled in third ventricle. So make sure you're familiar with this structure. You piece away those different layers, and tucked away here saying hello is our little cerebellum. So, the roof will be comprised of the telechoroidea, that choroid plexus-like thing with some meninges. The floor will include the optic chiasm. So you've got your chiasm more anteriorly, you've got the infundibulum running down, you've got the mammillary bodies posteriorly, with some hypothalamus here and some more brain matter along here. The lateral walls are the thalami, here and here. So just have a think about that. That's the area of the third ventricle. It was a whole learning outcome in Moxham, so it's worth paying a bit of attention to. And pause here, see if you can go through and find all of those structures. Just pop a pin on them, you know. So, for example, I'll give you one for free. Here's your corpus callosum. Right, so that's number 2. So see if you can pause them and go through. And that's some really good synoptic revision for you. So, the hypothalamus. Well, we've touched on this. Remember, we've got the hypothalamic sulcus. We have the thalamus above here. We've got our telechoroidea. We have our... I should probably use different colours, shouldn't I? Or just use the laser pointer. That would be handy. We've got the fornix. Oh, we've got the fornix here. The septum pellucidum. We have the corpus callosum here, and this corpus callosum will form the anterior commissure eventually, and then well, it doesn't form it, but it sort of penetrates it. And then we have the lamina terminalis, which is the rostral-most continuation of this corpus callosum. So we've got posterior commissure at the back, anterior here. This is our subcallosal region, if you remember. That's involved in depression. Then we have a whole mess of hypothalamic nuclei here, which kind of need to be observed in a schematic, which we'll draw in a minute. But I want you to be thinking, okay, so we've got our mammillary bodies. We have this region here. We have the lamina terminalis here. We've got the optic chiasm. We've got the infundibulum. We've got the midbrain, hypothalamic sulcus. So you need to be sort of thinking that these are the boundaries of the hypothalamus, because that's a learning outcome. What about the functions of the hypothalamic nuclei? Well, there are 4 different regions of the hypothalamus that we can divide it into anatomically, with subsections of nuclei. So I'm going to draw 4 regions here now. And because they're so small, unless you're doing really exquisite histological sampling, you don't need to know anything beyond the beyond these granular details here. So we have a preoptic region, we have an anterior region, we have a medial region, which is sometimes called a tuberal region. If you remember when we did the dopaminergic pathways, there is a tubero-infundibular tract that carries things from a certain nucleus here called the arcuate nucleus down to the pituitary gland, hence why it's called tuberal. And then we have a posterior section. So these are the four sections of the hypothalamus. Now, when you're drawing the nuclei, there's one at the front, there's two at the back, the tuberal one makes a face, and the anterior one makes a person. Like that. I kid you not. This is how we draw them, okay? So this one, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 11. Number 1 here, this is what we call the preoptic nucleus. And the preoptic nucleus is vital for blood pressure regulation. Number 2 and number 5 come together because they supply the posterior pituitary gland with ADH and oxytocin. They're also involved in cortisol release and a few other things, but that's the predominant thing. Number 3 here is what we call the anterior nucleus, and this is our big parasympathetic nucleus. Similarly, number 10 up here, this is our posterior nucleus, and this is the sympathetic. Number 4 and number 5 are linked together as well, so we have our suprachiasmatic and supraoptic nucleus. Suprachiasmatic is involved in diurnal rhythm, and the supraoptic number 5, as we said, is ADH and oxytocin. We then have number 6, 7 and 8 here, so can I just free up a bit of space? Bit of space, bit of space, bit of space, bit of space. So number 6, number 7 and number 8. Number 6 is our lateral nucleus. Then we have our number 7, which is our dorsomedial, and our ventromedial, with number 9 being our arcuate nucleus. Now our lateral nucleus is involved in thirst. Our dorsomedial is cardiovascular system regulation of the autonomics there. Our ventromedial is involved in feeding behaviours, as is our arcuate, but also in the regulation of prolactin secretion. Okay? And then the mammillary bodies, number 11 here, are keenly involved in memory. They have a lot of connections, hippocampus, fimbriae, fornix, running forward into the mammillary bodies. So, let's just quickly review that, because there's a lot to take in there. You need to basically pause the video and just repeatedly draw out these different nuclei until you feel comfortable with them. The faces are quite funny, at least, aren't they? So you've got preoptic, anterior, medial, posterior. And we have an anterior nucleus, which is the parasympathetic nervous system. We have a posterior, which is the sympathetic nervous system. We have a mammillary body, which is memory. Then we have this paraventricular and supraoptic nuclei here, which are involved in ADH and oxytocin release. We have suprachiasmatic, which is diurnal. Then we have this really important blood pressure regulator here. Blood pressure regulator here, and oh dear. So the anterior nucleus here and the posterior nucleus are your autonomic regulators. So this is our sympathetic nervous system, sorry about this, and this is our parasympathetic nervous system. The preoptic on its own here is involved in blood pressure regulation. I do apologise. Suprachiasmatic is diurnal. So blood pressure, these two are connected for ADH and oxytocin. This is parasympathetic nervous system, as it's the anterior one, and the supraoptic is diurnal. As we come to the medial tuberal division here, we have the thirst centre, which is the lateral region. We have the dorsomedial, which is cardiovascular. We have the ventromedial, which is feeding behaviour. And then we have feeding and prolactin secretion of the arcuate nucleus here. The posterior region is sympathetic. It does a few other things, but sympathetic is the main thing. And then memory there. And so that is the functions of the hypothalamic nuclei. Now, we're not going to go too much into the anatomy of the optic chiasm and pituitary gland relations, just because this is second cranial nerve, and we don't really cover much by way of the cranial nerves in this core Moxham curriculum, because there is an assumption that you have done pretty good detail on the course of those peripheral nerves. But here is our pituitary gland, the hypophysis as it's called. We have the infundibulum. It sits in the sella turcica of the sphenoid bone here in green. So from an inferior view, you can see a wonderful pituitary gland here with the optic chiasm right above it. So here's your optic chiasm. Here's the pituitary gland. Here's the optic chiasm with the optic nerves and tracts. Here's the pituitary gland. We have the mammillary bodies here and the midbrain here. If you turn this brain 180 degrees and plop it into the skull here, you can see its relations. So here is the infundibulum in the centre, like the yolk of an egg, and then around it is the pituitary gland. And you can see here, well, here's your cavernous sinus bilaterally with all those cranial nerves involved, and with the internal carotid artery, importantly, for cavernous sinus syndrome. But you've got the optic chiasm and the optic nerves here. So, pause. Can you identify these structures? So, for example, that should be mammillary bodies, not maxillary. Mammillary bodies, which I'll give you this for free, are here and here. And you know now that they represent that posterior portion of those hypothalamic nuclei. Remember, let me draw the little face. And then you've got posterior and mammillary bodies. So your mammillary bodies here. That's this maxillary bodies. So make sure you can find these. Particular tough ones are your occipitotemporal gyrus. Can you find your lingual gyrus on here? Can you find your gyrus rectus? Where's your parahippocampal gyrus in this region here? So, the pituitary gland, or as it used to be called, the hypophysis, is divided anteriorly and posteriorly. Okay, so our anterior pituitary gland here in yellow and our posterior here in green. The posterior ones receive all of their hormones, ADH and oxytocin, formed in that paraventricular and supraoptic nuclei. They travel down the stalk and they're secreted into the blood here. Oxytocin goes to various structures, and ADH mostly goes to the kidney tubules, particularly the more distal structures. But this is what you need to think about. The anterior pituitary, there's loads of them. There's loads of things. There's somatotrophs, gonadotrophs, thyrotrophs, corticotrophs, and mammotrophs. And they released a whole function of things here, which while we're doing anatomy, we won't focus on too much. But the point is that there is a regulatory input sent to the anterior pituitary gland where they synthesize their own things and secrete them into the blood. So that's a key difference in the anatomical workings of the anterior and posterior pituitary gland. So what about the hypothalamic pituitary axis? Well, they've got quite a few. We can divide them into somatotrophs, gonadotrophs, thyrotrophs, corticotrophs, and mammotrophs. And the somatotrophs are going to be secreting growth hormone, so human growth hormone. The gonadotrophs are going to be secreting follicle-stimulating hormone and luteinizing hormone. Our thyrotrophs are going to be secreting TSH. Our corticotrophs are going to be secreting ACTH, and our mammotrophs are going to be secreting prolactin. Okay? So they are our prolactin regulators. Let's make sure we've covered all of those. Yep, prolactin, all that jazz. Remember, what nucleus in the hypothalamus controls prolactin? It's the grin of the smiley face, the arcuate nucleus. So there is a direct connection from arcuate nucleus to anterior pituitary gland for the secretion of prolactin. And they have an inverse effect, right? So the arcuate nucleus secretes DA, dopamine, to inhibit prolactin release, right? So if you cut out dopamine, prolactin will be released, okay? So that's the relationship. So a patient on antipsychotics that have a blockage of the dopaminergic system in the tuberoinferiorfundibular pathway may present with galactorrhea. They've started lactating, male or female, usually female, because of the glandular tissue is already present in a much higher volume, but certainly both, because of the antagonism of this tuberoinfundibular pathway. And that is that. So we have filled out all of these learning outcomes today. We've done the general arrangement of the diencephalon, which is our thalamus, our subthalamus, our epithalamus, our metathalamus, and our, what did I do? Did I do some of those? Yeah. And our hypothalamus. And then we have the location of the third ventricle and its relations. So make sure you can think about what the roof will be, what the floor will be, and the walls. The location of the hypothalamus. So remember that hypothalamic sulcus, and then remember that you have the lamina terminalis coming forward. You've got the mammillary bodies arching at the back here. You've got the optic chiasm up here. You've got the infundibular stalk there going to the anterior and posterior pituitary gland. And then the function of the hypothalamic nuclei. So we've got the big anterior one, and then we've got these little structures here, and then we've got a smiley face. And make sure you can tell me the function of all of those and into which region they sit. Do they sit in the preoptic, the anterior, the middle, or the posterior? Pampers. Yep. And then we talked about the pituitary gland and its relations and locations. We talked about dividing it into an anterior and posterior pituitary gland. And then we talked about those somatotrophs. We talked about the gonadotrophs, the thyrotrophs, the corticotrophs, and the mammatrophs, which are cell types, secretory cell types, within the anterior pituitary gland that secrete things like human growth hormone, luteinizing and follicle stimulating hormone, TSH, ACTH, and prolactin. That's what we talked about. So subcortex part 2 next time. Yes, see you then, and good luck with the questions below.